My name is Betsy Davison. I'm a nurse practitioner here at Syracuse Area Health, specifically with Strasburger Orthopaedics. I started really young. I always knew I wanted to work in the medical field. As a kid, if anybody ever had a scrape or a cut or anything, I was the one that was like, oh, let me take care of it, let me bandage it, let me help you with this. So I knew from the get-go that was something I was gonna do. I started out going to undergrad as pre-med and decided that was a lot of school for something I didn't really know for sure I wanted to be a doctor, so I switched to nursing. I worked as a nurse for 13 years as a cardiac RN, and then went back to grad school, finished grad school while I was doing that as a nurse practitioner. And I've worked with Scott since, and orthopedics is actually really fun, and it surprised me how much I like it. I like helping get people back to being mobile and back to on their feet and living their lives and active and doing whatever makes them happy to get back to riding their horses or golfing or playing their sports or whatever it is that they're trying to get back to. It starts out with the first appointment of what are they coming in for, whatever their ailment is, and then we talk about treatment options based on what their goals are. Are you trying to get back to a certain activity level? Do you just want to be pain-free? Do you not care if you can ever get back to sports or riding your horse or whatever it is, skiing, any of that stuff? So then we just kind of work together on what their end goal is and how to get them there the best way possible. Some days we do clinic and see patients in the clinic, and Scott and I kind of bounce back and forth and see them together or see them separately to get through the whole clinic day. Other days we come and do surgery here, and so then it's getting patients ready for surgery with whatever help they may need. Helping in surgery, I assist in surgery through the whole process, and then afterwards help take care of them, get their follow-ups set up, get whatever they need, if they need walkers, any kind of work notes, paperwork, get all of that done so that they're ready to go home and be successful. This new facility is fantastic. For starters, it's giant, and the ORs are so much bigger than the other facility that we can do procedures more safely because we have more room to be spread out and have the equipment we need in there and make sure everybody is where they need to be and have the space that they need to have. The new OR was set up wonderfully with all of our orthopedic equipment that we need and to help us do surgery better and make it more beneficial for the patients in the long run. He's got a lot of years of experience and has done a lot of extra training on all of the things, all the surgeries that he does. Specifically Syracuse Area Health, because it's a small town feel and they get very specific patient-centered care. They're not one of 100 surgeries being done here today, so it's very personalized. Their call aids are answered in a timely fashion. The nurses and staff are here because they care about the patients and they want them to do well. They're not here for a paycheck. They want everybody to succeed and get on their way as best they can.